Hello and welcome to the Alastair Generationally Speaking podcast, where we look at bridging the generation gap by debunking myths, tackling stereotypes and showing practical tips on how we can build stronger intergenerational connections. Now, my guest today is a Gen X consultant, coach and trainer in psychological safety and co-regulation. She's also a therapist and yoga teacher specialising in working with children, parents and carers around neurodivergence and trauma. She offers playful support for adults and children to emotionally regulate, as well as helping people understand the very much undervalued tool of co-regulation, which we'll talk about in a while. She also works with businesses in crisis, helping to rebuild trust in impacting workforces using those same co-regulation tools. Today, we're going to be talking about Gen Alpha and younger Gen Z. What's different about being young today, parenting in 2026, and how that has evolved over generations. And then how we connect with children and what adults can learn from those children. So it's a great pleasure to introduce my guest today, Emily Haslam-Jones. Emily, good morning. Hello, how are you?
Good, thank you. Hello, Alastair. Lovely to be here.
We've got a lot to cover, and I really like the fact that the topic of this podcast is going to be quite different to many of the other podcast episodes that I've done. And one of the key areas that we're going to talk about is not just children, but also children who are, I used the term when we were talking before, neurodivergent, because sometimes for parents, you know, are your children neurotypical? Are they neurodivergent? Can be quite a tough thing to do, and that's where you come in, and we're going to talk about that role and how you do that in a while. First of all, I'd just like to talk about you. So what was life growing up for you? You know, you're being a Gen X. Were you typical Gen X?
Probably, I'm not sure. I think the thing that I really take from my childhood was that I grew up with this lovely balance of a dad engineer and a mum art teacher, and what that brought to our world that was, I suppose, a little bit different. So I always remember things like, you go to the beach and you just want to make a normal sandcastle, but dad's trying to help you build an irrigation system around it to try and make things like flow and all that kind of stuff. And mum's making huge naked bodies and saying, can you just go and get some seaweed for the hair? And like, it's this whole kind of like way that we grew up. With those kind of freedoms that you had in that generation, where you could go off and play outside and be unmonitored. And I do think that is one of the big things that makes me really sad is, it's good that safeguarding has gone up in the world and that we are caring and looking out for people that, to make sure that people are looked out for. But then there's that freedom and that ability to take risk within that freedom that I think is one of the contributing factors to a more anxious youth generation these days.
Well, you've obviously read Jonathan Haidt's book, The Anxious Generation, because that's what he talks a lot about, is this over-parenting in the real world and under-parenting in the digital world. And, it's all comes from the best possible thought processes, but there is a lot of talk about maybe some of that, not allowing that free play where they can discover things. It's a real balance. Where do you lie with your children and working with children in terms of getting that balance between not over-parenting, but at the same time, you've still got that safeguarding in place?
The work that I do is very specifically based around very research techniques that have been going for a really long time, although I don't stick, being neurodivergent and ADHD myself, I do not stick to any formula, but there are very solid foundations in the kind of early part and early steps of things that are from techniques like the Incredible Years, helping the non-compliant child. There's so many parenting techniques that use this one particular thing, which is the very first building block is to make sure that you're putting in a daily dose of just 10 minutes, 15 minutes of being really present with your child. And that being really present with your child, it kind of fills their cup in a way. And it's very much about doing it in a way where they don't have any interruptions. So it's like you kind of become like a game show host, right? You can't ask any questions, give any instructions or any directions, say what you see. So you're getting them to describe. So it's like commentating like sport. And what it does is it allows the child to truly be seen, and you're not interrupting with questions or putting your stuff into it. And that is really, really, we know it helps to build attachment or rebuild attachment with trauma. We know it helps. And it's this foundation with which you can then move to other things. And I think it's not just quantity of attention, it's quality of attention and connection. And that is what I think is the thing that people find so hard to be skilled with and give with the way we live today. And that is really the foundation it all gets built on.
And that's a challenge that a lot of parents have today, isn't it? Because, you have, if a child looks busy, they're doing something, then actually that's fine, and I can crack on with the rest of the things I'm doing. And let's be honest, pressures on parents to do so many different things, juggling everything is really hard. So if the child's actually just quiet and happy on a device for a while, it's very understandable how that scenario can take place. But you're obviously advocating, understandably, just find 10 minutes a day, just have that real time, and that can make a lot of difference. And the other wonderful
thing about what we don't do, which is this is the top tip, and it sounds so simple, but it's one of the hardest things to do. When a child is doing what we want them to do, so for instance, I could actually do a very, very fine example right now, because actually my son is a little bit poorly off school, and he has come and he's sitting just outside the door, right? And so what I would do in the situation, because I've asked him very kindly that I need to talk to you, Alastair, and I can go to him, thank you for being really quiet. Alastair, that's really kind of you. Thank you so much, Isaac. I will come and give you some of my attention later on. Thanks, darling. But that thing where we are so busy doing the thing that we're doing that we forget to tell them, because it's not causing us a problem. We don't tell them when they're doing what we want. We give them loads of attention when they're doing what we don't want them to do. That gets loads of our attention. But when do we give attention? When we see them doing what we really want them to do. And it's actually a really hard skill to develop, because my attention is with you, right?
Well, for those people, for those of you who are just listening and don't have the video, young Isaac just came into frame there, very, very briefly, just to say hello, and then has gone again. And it's really interesting, isn't it? Because you often hear about children being attention seeking, because actually it's because you're not giving them that attention at that moment.
I like connection seeking is a better term. I'm not sure if you coined it, but connection seeking. It's on a little post-it note right there. Yeah. When you frame it as connection seeking, you get less triggered by it.
Interesting. Yeah, no, I like that. Oh, we've got some pearls of wisdom already. Absolutely brilliant. I knew we would. So let's get back to the generational aspect of this. When you look back at your childhood and you look at bringing up Isaac and your other children, and you look at the children that you work with, how different is their world in terms of the way that can affect who they are as individuals and affect their behaviour?
Our attention is so split. Everyone's attention is so constantly split with devices, with demands, with, I think, even more so since COVID and people working from home. So they've got this kind of capacity to be there and not be there, right? And the way that emails and things pop in and we respond to them as and when, rather than having this boundaried work experience. And to set our own boundaries with it is really hard. And particularly, I think sometimes, well, I don't know, I say particularly with self-employed, maybe it's not. I think, certain jobs also are very high demanding. And sometimes it feels like the demand is urgent, even when you actually sit back and think about it. It's like, is it really? Or things like, when you contact someone and they're on holiday and they're not at work and they're answering the message and you're like, don't do that. Don't answer my message. Like, no, don't do that. You're not at work. It's, it's those kind of things which are making us also strung out and also scattered in our attention that, it is becoming really challenging. And for us, we're not modelling that. So how can we expect that from them as well?
And do you think that, we know that those demands are massive at the moment. And one of the things that's, people seeing Gen Z coming into the workplace, that they are looking for attention, they're looking for connection, to use your word, and because they're used to it, but they want people to be present, whereas sometimes we're around our children, we're around each other, but we're not actually present. And is that the fundamental issue that you're seeing here?
Yes, we're not present, and it's also that our nervous systems. So I don't know if you've heard of the polyvagal theory, Stephen Porges. So it's very much about what we call neuroception. So how our nervous systems talk to each other. The hypothesis is that because human brains need to develop more, we're born before we're fully developed, right? We have these big brains, and we don't get up and run the minute we're born. So we need to be able to have this nervous system where our caregiver affects us and we affect them. So we have this we're hardwired for connection. We have this way that we need to connect, and that's a very human experience. But if our nervous system is constantly taxed by demands and we are dysregulated, how can we then be a connection for them to help them regulate? And so that's why I do an awful lot of work where I work with the parents to help the children, because normally that's, if the parent hasn't got the capacity themselves, all the work in the world with the child isn't going to change anything, really. It's not going to get you anywhere.
And isn't it fascinating how that replicates into the business world, where you and I probably will be brought in by an organisation to say, can you help? And what they're saying is, can you help us? Can you tell Gen Z to connect with us? Can you tell them this is what they need to be doing? Where actually what we need to do is work with those managers and leaders to say, actually, this is everyone's part of this process. It's not just telling one side what to do.
So much so. I mean, and the more complex the conversation, this is where the kind of the trauma-based stuff comes in, the more capacity you need. As a parent, you need capacity. If you're dealing with somebody who's distressed, you need capacity. If you're dealing with a distressing topic, you need capacity. And without working on yourself, is that old classic, be the change you want to see? Without working on yourself, you're never going to get the results you want. And that is when I work in business, is very much how I work. And I realised a very long time ago, before I was in this world at all, I used to be a humanitarian worker in conflict. And part of my job was to make interventions to talk to people who had made violations of the humanitarian law about that. Now, if you walk in ready to tell them what to do, you get nowhere. Like, their back's up straight away. So you have to build connection, to build openness so that they're going to hear you. So you have to attune I didn't know about co-regulation, but you have to get co-regulation going. You have to get your nervous systems attuned for them to be in a place where they could possibly ever hear what you're going to say or accept it. So I think I didn't know it, but I've always been doing the same work.
And I used that term in your introduction a couple of times. You've mentioned it a couple of times, this term co-regulation. And I can imagine lots of people are coming up with all sorts of definitions of what that actually means. So talk us through, what does co-regulation mean, and maybe give us an example of it in practice.
So we co-regulate and co-dysregulate. Our nervous systems pick up on other people's nervous systems and vice versa. So we can start to have better feelings or worse feelings because of our contact with another human. You were at the conference last year where I dysregulated the audience to show them by making them hold their arms have been there for a long time and put them under stress. So what I did in that example was, then I asked everyone to look at somebody else that looked like they were coping well with the situation. And so that is that kind of attunement. You're starting to use another nervous system to help you through an experience. So with things like parenting, if a parent is struggling to get a child to sleep and it's going on and on, we know sleep deprivation is a method of torture for a good reason. Yeah, it completely dysregulates us and scrambles us. But if a parent is spending hours trying to get a child to sleep and being there resentfully, how can they ever help that child to get to sleep? Because the child's picking up on their nervous system. And my personal hypothesis that I haven't tested is that I suspect that neurodivergent people and people with trauma histories are more sensitive to picking up on other people's nervous systems, and they use co-regulation a lot. They will want to connect more with a parent or anchor into a parent's nervous system more. So that affects lots of things, like sometimes separation anxiety, or going into school, or various things like that, or going to sleep. So and we've got this kind of societal cultural attitude that's very much like, our baby needs to go and sleep on a cot on its own. We need to be able to do this on our own. And actually, I think for a lot of neurodivergent children, or children that have had difficult adverse experiences in their childhood, they need something else, and that's okay. But it seems to be, the parents are often very kind of, they feel ashamed that their parenting is judged. But they also need to learn to set boundaries, because sometimes it starts to cross over a line where it's not serving the child, because the child also needs to be functioning in a world that hasn't always got their parent in it. So often they come with this muddled state where they've been adapting to a child's needs, and at the same time it's sometimes gone too far, and the child has realised that they can get certain things to happen and their parent to behave in a certain way, or meet their needs in a certain way. So it's like this. That's why no one method works, because what we call low demand parenting, where you take all the pressures off the child and we don't ask too much of them, if you're not careful, you create a child that can rule the house and gets their needs met, and then everyone else is just exhausted and resentful. If you try to push too hard into parenting in a way where you're very boundaried and the child's needs have to come secondary and we have to do what we want, then particularly with neurodivergent and traumatized children, you're going to end up with huge meltdowns. Those behavioral psychology shaping behavior things are too rigid. What the reality is, you generally need something in between, and that's what I help people to get exactly right. Yeah.
So coming to co-regulation is kind of like it's being in tune with each other. And one of the things that you said there, which really resonated with me, was the way that effectively you're saying we live in an absolutist world. It's that way or it's that way, and it's all very sort of niche, not niche. It's very sort of putting things into boxes. A little bit like the way that I talk about generational differences. People like to say, well, Gen Z are like this and millennials are like that. So it becomes very two-dimensional when, of course, we know the world is a lot more complex than that. So with your work and business, are you also trying to reduce that absolutist mentality to get people to think a little bit more individually and personally?
Yeah. And I think for me, it's like my work with businesses. It's about building trust in yourself and confidence in the parent's self to be able to make the right choices for their child, and confidence to set boundaries. Because I think sometimes we think that we are serving our child to be almost like their friend and to meet their needs. And I do think that has maybe been a little misunderstood, and because boundaries are really important, because they help a child. It's like a garden fence, so you can play in the garden. It's like it helps the child to be able to know where the edges are, and that the world will not completely bend around it. It's not possible. So I work with a lot of what's called demand avoidance, or it's a pressure sensitivity, anxiety driven by the demands of life, and it's generally been linked to the autism side of the neurodivergent spectrum, but I see more and more that it does present with ADHD as well, yeah. So with that kind of thing, you've got to be quite careful about how you boundary set, but you still need to do it.
Yeah, absolutely. I mean, at the end of the day,
my son is pacing the floor, asking where the yoga mat is, which is amazing. He's asking me where the yoga mat is. Isaac, it's in my bedroom. You can go and get it. Thank you for waiting. Right, there you go.
Okay, so
praise
just
is really important. Praise within 5 seconds of them doing the thing you want to see is the most effective kind of praise.
And that's a really interesting note, seeing it in action there as well. So excellent. I was going to say, should we keep that in? And actually, yeah, I think we should keep that in because I think that just
I'm
shows
giving some kind of
the demands of
live
parenting.
dual. and it's awful because I'm doing exactly this thing we're talking about. I'm at work, my child is off sick, I'm still trying to work. This is the problem, right? Our split attention. This is exactly.
But there's massive parallels between parenting
right?
and management. And I actually often have been heard to say that, parenting and management has never been so difficult. It's never been so challenging because there's so many different elements. You don't have this world where it was before, where it was absolutist. It's right, it's wrong. You do this, you don't do that. The very strict boundaries. And then we almost opened the floodgates. And now it's trying to find, well, there's a balance there somewhere in the middle. And I'm guessing that balance will be very dependent upon those individuals, both the parent and the child, both the manager and the staff member. So what kind of process do you go through to establish that balance?
Well, I mean, it is a case-by-case thing, right? You go into the situation in the business, you meet the parent, the child, and in therapy we do an assessment, and you try to find out as much as possible. You make a working hypothesis, you start working with it, and maybe along the way you start to realize that maybe it isn't quite how I thought it was. It is really, with children, very much about trying to work out how much is an underlying kind of, I suppose, a mental health thing like anxiety driving the behaviour, and how much the child has learnt, if I do X, then I get Y, so I'm going to keep doing it. And the exhausted parent has started to bend. So, So it's always a case-by-case sort of situation, and it evolves, and that kind of thinking, adapting on your feet around using all experience in your toolbox and all the things that you've built up is definitely a skill of the ADHD people like myself and something we really enjoy.
And it's definitely a generational thing. I did a talk recently which was designed for just a general public, light-hearted, fun look at the different generations. And it was called "Why Don't My Kids and Grandchildren Listen to Me?" And it was basically how we observe the different generations. And one of the things that is, I think, a really interesting dynamic here is the grandparents of the child, because I don't think any grandparent has ever really fully approved of the way that their child has brought up their grandchildren, because things have changed, things have evolved, and people think differently. So do you get involved with grandparents as well to bring them into the mix so that everybody is, on the same playing field, as it were?
So, I mean, I work with whoever comes to me. Sometimes I get families where it is, it's mostly mums, I have to say, but I do sometimes get mums and dads, and sometimes the information gets passed at home. Have I ever had just a dad? I don't think I have. I know colleagues who have. Yes, and it is that question also, because there's also a cultural assumption that the main caregiver is going to be a parent, but actually sometimes grandparents are very involved and very much part of a joint family world. And so, well,
especially when parents are taking, they're doing a lot of, babysitting, they're doing a lot of childcare in those early days. If indeed the parents have that, luxury of having grandparents nearby, and of course in multi-generational families, that's often seen as a great way to increase cohesion. But there's also going to be different viewpoints, shall we say, on how to bring up the children.
Yes, there is, and different levels of attention. I mean, grandparents have normally just naturally got a lot less on their pay. It depends. I mean, they can still be working, of course, these days. But they are inclined to giving more full attention, which is maybe partly why it's often a very good bond, right? Because that need for connection is being met, and it's less split. I forgot what the question was.
Well, the question, yeah, that's absolutely fine. It's just basically the different methodologies that parents adopt, and then because it is often generational. When we look at some of the practices for bringing up children from 30, 40 years ago, have been put into serious question of whether, how good they were, how positive they were, and so on. So then dealing with that potential, not conflict, but, mild disagreement about how you bring up a child is tough, because ultimately it's the parents, but grandparents are also involved.
I guess that it comes back also to the sort of thing around boundaries, right? So that as much as though you need to set good boundaries with your children, you might need to do it with your parents too. But then also that's one of the joys of grandparenting, that kind of unbounded, I'm going to let you eat an ice cream even though your dinner's in half an hour sort of thing, which is this relief that they do, because they would never have done that with their own child, isn't it? That there's that wonderful thing that goes on where they're like, I'm just going to do that. And you're there as a parent going, you would never have done that for me. So it's interesting. So it really depends on what the issue is. I mean, there's some very hot topics, and there's some areas where maybe it really is like, I need my child to be parented in this way. I need you on board with me. These are the reasons, that kind of thing. But yeah, I think grandparents do quite like breaking boundaries with their grandchildren. Don't you think?
Again, this is all about, there's a lot of different things at play in generational theory. You've got your physical generation, you've got, social evolution, how are things changing, what are common practices. But then, of course, you have the stage of life you're at. So all of those things will influence who you are as a person. And of course, as I always say, we're not we're framed by our generation, not defined by it, because of course we're all going to be different. So just wrapping up here, Emily, we've talked a lot about making sure that we give quality time to each other, and again, that's a business thing as much as it is as a family thing. What else would you say are key tips to increase that generational cohesion within the family, between parents and their children, that will hopefully make life a little bit smoother in the home? And of course, these can be replicated in the workplace as well.
Yeah, I mean, the thing that I do, and I do it as a sometimes as an online workshop with parents, or individually with parents, and also with businesses. I have a capacity building tool where you build your capacity cache, and it's really that oxygen mask first kind of attitude. And it's something really important to model to our children, that self-care is not a selfish thing, that it is a thing that you really need to do to be able to have that capacity to connect. You need to be able to go away and do what you need to do. So my things are, yoga, unsurprisingly, having been a yoga teacher since 2007. I jump in a lake every Wednesday morning, no matter what the weather is. That gives me 250% more dopamine, makes my ADHD brain work better. And, when my parents, when my ex-husband is away and my children are with me, I find a babysitter, I find someone to come so that I can keep my practice. And that shows them that I know how important it is that I look after me, because that is for them. It is for them, because then I'm a better parent. And I think that we sometimes think that being selfless and giving people everything they need at our own cost is a useful thing to do. And it's really not. Because if our nervous system is jangled and burnt out, what have we got to give? How can we possibly connect in a constructive way and make constructive things happen? So for me, the biggest thing is self-care, modeling self-care, and that looks different for different people. It can be that really just sitting on your own, drinking a coffee and being reflective, calling a friend. I'm always an advocate of physical movement being a big part of it. I think being still too much isn't really what we're designed for. But yeah, there's a lot of ways, creative things, there's lots of ways it can look. And yeah, it's definitely something within my coaching work and my therapy work that I always have a while where we focus very much on how we can work with our own nervous system so it improves our connection to others.
Yeah, and you're absolutely right. It always starts with self-awareness and, before you start influencing others. Emily, it's been a real pleasure to talk to you today. We've navigated all sorts of areas when it comes to parenting. We've discovered the parallels between parenting and in the business world as well. And thank you for giving me your full attention. Really appreciate it. And I can see young Isaac there behind you wanting to say goodbye as well, who's now going to get your full attention.
Yes, he's definitely going to get at least 10 minutes of my full attention now. I think he might want to do yoga, which is wonderful. Not always the case, so not if I suggest it anyway. But thank you so much for having me. I found it really fascinating to reflect and really enjoyed the questions. So thanks, Alastair.
A pleasure. Thank you so much, Emily. And thank you for joining us. We'll be back in 2 weeks' time where we'll be talking to somebody else about how we can bridge the generation gap. Bye for now. The Alastair Greener Generationally Speaking podcast was presented by me, Alastair Greener. It was recorded at Granary Studios and produced by James Jones. Please follow us and leave us a review wherever you get your podcasts. To find out more, visit generationallyspeaking.co.uk.